Welcome to our educational presentation on interventional procedures for lymph node management in breast cancer. Before we begin, please note the following. This presentation is for educational purposes only. It is designed to enhance understanding of medical options available for managing cancer pain. The information provided should not be used as a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information, is the property of drsimplified.com and is protected by copyright laws. Reproduction, distribution, or transmission of any part of this presentation is strictly prohibited without prior written permission from drsimplified.com. Thank you for respecting our work and rights. Welcome to our next video on lymph node management in breast cancer. Diving into the management of lymph nodes in breast cancer, let's explore this vital aspect of treatment through an insightful conversation with Siraj.
Imagine, Siraj, we're gardeners tending to a beautiful, complex garden. Our patient, and discovering some weeds, representing cancer, have spread to a section called the axilla, or armpit area.
How do we figure out which plants are weeds?
First, we examine the area carefully. Sometimes, we use a special tool, an ultrasound, to see beneath the surface. If we spot anything suspicious, we take a small sample, a biopsy, to confirm.
And then, what's our strategy to remove these weeds?
Our approach varies. If our garden hasn't received any treatments like neoadjuvant therapy, we start with either a sentinel lymph node biopsy, gently removing a few key nodes to check for cancer, or a more extensive cleanup called axillary lymph node dissection.
What if the sentinel biopsy finds something?
If it finds a few affected nodes, we might not need to do more surgery. Instead, we focus on the right fertilizer, radiation therapy, for that area, especially if the garden's structure, a mastectomy, has changed significantly. But if more nodes are involved, we opt for a thorough cleaning and additional treatments to ensure the garden thrives.
Does every garden need this level of care?
Actually, some older gardens, especially those with only a small area of concern and receiving gentle care, endocrine therapy, might not need an extensive check under the soil. And what about after neoadjuvant therapy?
We re-examine the garden, right? See if the treatments help before deciding the next steps.
Exactly. If previously affected nodes now seem clear, we proceed cautiously, sometimes needing only a sentinel biopsy to guide further care. Yet, if weeds persist, we're more aggressive in ensuring the garden's health and beauty. Navigating lymph node management is a delicate balance, Siraj, like maintaining the perfect garden. It's about choosing the right tools and treatments to keep the garden flourishing.
Through this engaging analogy, the complex topic of lymph node management in breast cancer becomes accessible, emphasizing the tailored, thoughtful approach needed in treatment. See you in the next video. Thank you for watching. Thank you for participating in our educational session. We hope you found the information valuable and enlightening. Reminder: this presentation is the property of drsimplified.com. Any use of the content, including copying or distributing without explicit permission, is strictly prohibited. For further information or to request permission for use, please contact us at contact@drsimplified.com. Stay informed and take care.